Hello and welcome to the Consistency Project with E.C. Sinkowski. My name is Patrick Cummings, and every episode I have the privilege of having a discussion with E.C. on subject matters that range from nutrition to fitness to the choices we can all make to live a healthier, more functional life. By exploring both the principles at play and the actions worth carrying out as a result, it's our goal to get you thinking, get you moving, and get you taking more consistent steps toward optimizing your well-being. Thank you so much for tuning into the show this week. I am here with just a quick introduction because this week we have a conversation that EC had recently with Krystle Zuniga. Krystle holds a PhD in nutritional sciences. She's a registered and licensed dietitian and is a board-certified specialist in oncology nutrition. You can find her on Instagram at Cancer Nutrition HQ, and her website is also cancernutritionhq.com. EC and Krystle get into a whole lot in this conversation, including which cancer-causing myths we can safely ignore and whether any specific dietary patterns like fasting show positive signs of preventing cancers. One quick note, if you are not yet subscribed or following the show wherever you are listening or watching this, please do. That will ensure you do not miss a future episode. Okay, without further ado, here's EC and Krystle Zuniga.
Thank you so much for joining the Consistency Project today, Krystle.
Well, thank you for inviting me. I'm looking forward to our conversation today.
Yes, this is definitely one that I've had a lot of questions about. I actually have a older podcast with a former mentor of mine where we talked, I think, a little bit more about kind of treatment or the idea of using nutrition with treatment. So today I was hoping to get your expertise a little bit more on the prevention side and maybe what we understand about cancer. I certainly enjoy all of your posts on social media, so I thought you were the perfect person. I think one of the first places to start, I mean, out of all of the diseases, I think cancer is the one that most people are concerned about the most. And so one of the things that I wanted to get a sense of, how is it going overall in the sense of, is cancer really increasing that much? Or are cancer rates getting worse? Is some of this that we hear about all these statistics related to kind of the new diagnostics that we have? Like, can you give us kind of a sense of things? Are they getting better or worse for us?
Yeah, I would say that there is a general understanding from the people that it's increasing, but when we look at the statistics, because it's being talked about more, but when we look at the statistics over the past 5 years, it's actually been pretty stable in incidence of cancers. There have been some cancers where incidence is increasing, and so we are hearing more about them, and we could talk about that. Like, for example, colorectal cancer rates are increasing in young adults. But overall, we also have an aging population too. And so cancer is also a disease of aging. So as our population lives longer, incidence rates are going to look higher as well. Mortality, we've actually been doing better. Cancer mortality has been decreasing. If we look at specifically like lung cancer, as there's been less people smoking, less incidence of lung cancer, so mortality has decreased as well. So if we look at it globally, incidence has been pretty steady. If we look at different cancer subtypes, yes, the rates look like they are increasing in different cancer types. But then when we look at survival and mortality, that has been improving as we have earlier screenings, earlier detection, better treatment methods as well. So also, it's kind of hard to really nail down statistics because when we talk about cancer, cancer is not just one disease, right? Over 100 different diseases under that umbrella. But if we want to look big picture, it's not really increasing. Although you might hear about it more, which is great, more awareness. We are doing better at treating it as well.
Yeah. Yeah, I think that's a great point that it's easy to forget in social media land that, when you say cancer, it's really a lot of different subtypes that we have to be more keyed into. And then also, just that incident rates don't necessarily also tell us exactly how many people are surviving. So to kind of keep that bigger picture in mind for sure. With some sort of things that come up in headlines besides different maybe incidence rates and how frequent cancer is or how much more it is in the public, I think there's this kind of general belief that everything causes cancer almost. we're afraid of so many different things out there. Maybe it's from GMOs to, I don't know, Wi-Fi or, electromagnetic fields or something like that. Can you give us kind of a sense of what are some misconceptions about what causes cancer, and kind of help us navigate some of the headlines and the fear mongering out there?
Yes, I think you brought up that really good point that there's really quick headlines about things, and it can feel like everything causes cancer. You sent me a study that was interesting to read that people think that. And unfortunately, that message too could get people to think of, well, then it doesn't really matter what I do. Everything I do is going to cause cancer. Right? But when we look at what cancer is, it is caused by a genetic mutation in a healthy cell. Right. And so when we look at what can cause cancer or lead to an increased risk of cancer are things that can lead to DNA damage and mutations. Right? Unfortunately, there are misbeliefs that things like GMOs or pesticide residues, food additives, artificial sweeteners cause cancer. When we look at the research, that is not what we see, these are factors associated with cancer. And unfortunately, more people believe that these things lead to cancer than what we actually know from the research. There's a study from, not really a study, it was a survey from the American Institute of Cancer Research, and they asked about all of these different factors and whether people thought that they were associated with cancer risk. More people thought that pesticide residue and GMOs were associated with cancer than people that knew about the association with high-fat diets, low fruit and vegetable intake, physical inactivity, obesity, red meat. So these things that we do have research on, people aren't aware of. So that's really where this misinformation can be harmful too, because it crowds out what is really the truth and what are some modifiable factors that people could use to modify their risk of cancer.
Yeah. Yeah, I mean, I think it's just so reflected in the questions that I get. I mean, I deal specifically kind of the general wellness, health, fitness realm, and more of the questions I get are about what about, GMOs or pesticides than necessarily worried if we're getting enough fruit and vegetable consumption. So that ultimately was sort of the impetus behind my message and what I kind of put forth in the space for sure. It was just this focus on things that aren't really important, or at least to the level where we know, which I guess kind of leads to the next great point. You already kind of hinted at them, but can you, everyone wants to know about how to prevent cancer. So can you tell us what we actually know? Again, where we have definitive decrease in risk, what practices, diet and lifestyle wise?
Yeah, if we want to look at lifestyle wise, the American Institute for Cancer Research, again, another great resource. This is a nonprofit organization. They bring together researchers and experts in this field to evaluate the strength of the evidence and the body of the evidence. And they came up with 10 cancer prevention guidelines. And they include maintaining a healthy body weight, because we do know that obesity is linked to about 13 different cancers. Eating a more plant-forward diet, so whole grains, fruits and vegetables, because fiber has been associated with a reduced risk of many cancers. Limiting red meat and avoiding processed meats, because that has been linked to, more specifically, colorectal cancer. Being physically active as well. Alcohol, to mention that one, avoiding alcohol. But smoking, I think most people are aware of that as well. They also recommend to not be using supplements for cancer risk reduction. There is not research there.
Wow. Can you say that one again?
That we should not be using supplements for. Yes, we should not be using supplements to reduce the risk of cancer. And this came from actually a couple different studies, one done for prostate cancer, one done for lung cancer, and found that actually some supplementation of specific nutrients was associated with an increased risk of cancer. So if someone is getting enough from their diet, adding even more, now you're getting into more of like a pharmaceutical level, which can have impacts on cell growth, for example. So they specifically put that recommendation. I don't know if that might change as we've actually learned a little bit more about vitamin D and its role in cancer, but right now it says not to use that. And so those are some of the big lifestyle behaviors, like not smoking, not drinking alcohol, eating a more plant-forward diet, limited meat, not drinking sugar-sweetened beverages. That was another one, but that's more linked to not that sugar-sweetened beverages cause cancer. Sugar-sweetened beverages associated with obesity, and we know that that can increase the risk of many cancers. But then also now, with vaccination, HPV vaccination, hepatitis. Also, there's vaccinations available for that because that can lead to liver cancer. So there's definitely many modifiable risk factors. And of course, sun exposure. Actually, we do need to talk about that now because there's people saying that you shouldn't be wearing sunblock.
Right. It's not natural. Okay.
Yeah. Even though there's been so much research about UV exposure and skin cancer and melanoma. So, we do have to reiterate those things. I won't be surprised if we hear people saying that smoking's fine again, just because there's just
everything comes back.
Yeah. Just that people want to combat what is conventional knowledge just to, gain some attention. But
yeah, just to recircle back on the vaccination. So you're saying get the vaccinations because with the infection then is linked to increased cancer risk.
Yes, thank you for clarifying that. Right, that vaccinations, now that HPV vaccine is available, hopefully that can help again in reducing this increase that we've actually seen in head and neck cancers that are related to HPV. And then we know cervical cancer is also related to HPV. So this is something that there's now a vaccine available for. And for those at risk of exposure to hepatitis, that vaccines are available because that can lead to hepatitis, can lead to liver cancer.
Okay. Interesting. One of the things that I find difficult explaining to my community and clients is the distinction between those preventative strategies that you just mentioned and then why those aren't the same as what we use for treatment. It's this idea, okay, well, if I'm just eating the fruits and veggies and I'm living the active lifestyle, then why can't, if I have a cancer diagnosis, is low carb going to do it or cut out the sugar or anything like that? Can you help people understand the difference kind of between these preventive strategies and treatment strategies and why they have to be so different?
Yeah, that is a great question because, yes, there's many lifestyle behaviors that we know reduce the risk of cancer. And the mechanism by the way that they're reducing the risk of cancer can be through supporting the immune function of our body so that it's on better surveillance to capture cells and take care of them before they overgrow. Reducing our exposure to carcinogens like smoking, right? Or direct damage to DNA from UV exposure, or including things in our diet that help with that functions of reducing DNA damage, reducing inflammation that can cause, DNA damage. So when we look at these lifestyle behaviors, they're more of things that are helping support our natural strategies to try to ward off DNA damage and repair DNA damage. But then when we get to a site of a cancer cell, the rate of growth in these cells is exponential compared to healthy cells. They're not really caring if their DNA is mutated or damaged. They can continue to replicate and grow. So these behaviors that are meant to help reduce DNA damage might not be as effective once that DNA is damaged and these cancer cells are overgrowing, right? And not really responding to normal signals to stop growing. And kind of really want to hit home about the complexity of cancer treatment. Most people are not, if they're getting chemotherapy, it's not one drug. We have to target multiple pathways that these cancer cells are using to grow because they can become resistant to things. Like, okay, you shut down, you brought up the example like low carb. Okay, you reduce glucose availability. Okay, then we're going to use this other pathway to grow. And then you get some more selective growth of those cells that do well without a lot of glucose availability. So we do know that because cancer cells are dividing so quickly, they can mutate quickly. We're going to see selective resistance to therapies. So we have to have a more complex approach to treatment and say, all right, just cut carbs and cancer is going to go away, or go on alkaline diet and cancer is going to go away. Cancer, unfortunately, is so much smarter than that.
Right.
And that's what makes it so difficult to treat.
Yeah. Yeah, the complexity and just how adaptable it is. It's sort of like our prevention strategies. Somebody described this to me, actually, one of my comments that I really liked, and it was something like, I think health is simple and disease is complex, right? It's like a shotgun approach. And we're just trying to cover our bases, doing the best we can. And once something comes along we need to treat, it really is complex and quite detailed, and we don't actually have all of the knowledge yet to be able to target to the degree that we want to. Yeah. Okay, so back to the headlines a little bit. We were talking about these strategies to decrease our risk. I think that's also where we get a little bit lost, is really understanding what some of those headlines mean. I think you mentioned colon cancer, but it's like the decrease risk of colon cancer by decreasing consumption of red meats. And so can you help us understand that a little bit, as well as why sometimes when you read on the headlines, you might get afraid of, drinking alcohol or eating red meats, and trying to put that in perspective for us?
Yeah, right. They'll report things like it increases the risk by 20%. And that seems like a really big number. And that is actually when we look at cancer risk, but we have to put it back into the context of what is the risk for that cancer. And so we can do a little bit of math here. For example, breast cancer. The absolute risk of developing breast cancer is 1 in 8 women in their lifetime will develop breast cancer. Okay. And it's estimated that alcohol intake, and actually pretty modest intake of about 1 to 2 drinks per day, can increase the risk about 30 to 50%. So alcohol is a pretty significant risk factor for breast cancer. But even then, if we kind of do the math of this, that would be normal risk, 125 in 1,000 women. Those that are drinking 1 to 2 drinks a day, that increases it to 188 in 1,000. Right? And I wanted to use that as an example because that's one of the highest, risk factors and the most prevalent cancers in women. Still show that even with this risk factor, this is not a guarantee that you're going to get breast cancer. If you eat a hot dog, that is not the guarantee that now you're going to develop colorectal cancer. So yes, we need to be aware of these risk factors, but not to a point where it does make you scared of any potential carcinogen exposure in your life.
Yeah. Yeah, that's a really interesting point. The 30 to 50%, I wasn't aware of that, as that was the magnitude of it. And as far as I understand, like you just said, though, that is kind of one of the higher dietary factors in terms of the ability to swing a risk. Yeah. And then putting it in context of something like genetics, right? I mean, if you compare some of what the genetic risk might be versus a dietary risk, genetics normally trumps a dietary risk by at least an order of magnitude, right? In many cases.
Yeah, for like breast cancer, someone with a mutation in the BRCA gene, it's like an 86%, increase. Not 100% guarantee, but yes, a much order of magnitude higher, something like that, or someone with like Lynch syndrome, that's like 100% that they might develop colorectal cancer in their lifetime. So yes, the genetic factors truly run stronger, but to understand that there's still some modifiable risk factors and the magnitude of them. For someone who has, for example, genetic risk, it might be even more important to really pay attention to these modifiable factors.
Yeah. Yeah. And the other point in there that I just really want to highlight that people heard from you was, we'll stay on the breast cancer and alcohol one, that even by eliminating alcohol, somebody still has risk. Yeah. Yeah, everybody has risk. You have breast cancer risk, right? You have colon cancer risk.
Except the risk of developing cancer in one's lifetime, 1 in 2 men and 1 in 3 women. But that it can be a pretty dire looking statistic. But also when we look at why do we say that lifetime, is because as you get older, your risk increases.
I think it's really helpful for people to hear that, in part for people who do have cancer. I've heard from many people who they're active, they eat a whole food-based diet, and it's almost this guilt, or I don't know what the right word is, but they feel like they didn't do something correctly, and it's understanding that everybody has risk. Yeah.
Absolutely. I've worked with individuals who were running a marathon, before they got diagnosed, vegetarians, vegans, people who never had alcohol or healthy their whole life. So we don't really know what could cause their cancer. Like I said, we're exposed to many carcinogens, toxins in just our environment. We can't completely avoid these things. And all it takes is for one cell to acquire those mutations for that then to become cancer. And unfortunately, part of that guilt does come from people thinking that that was that individual's fault. There must have been something that they did. And unfortunately, I have heard that from many survivors, that people ask them, what did you do? Like it was someone's personal failure. And there's just needs to be much more awareness about that. Yes, there could have been some things that increased their risk, but they did not cause their cancer.
Yeah. Thank you for that. So let's take those individuals who are doing all the things already. They're doing the active lifestyle. They're eating the fruits and veggies. My group is going to be well-versed in that. We talk about fruits and veggies a lot. So let's say they're there. They're doing all of the things, not smoking, etc. What else can they do? I do typically deal with a crowd that is quite proactive. So they're willing for the next 1% on everything. What would you suggest if there is kind of the next 1%?
Yeah, absolutely. I think we have great technology now with genetic testing. So if you do have some family history, not even just your primary, your first degree relatives, but other relatives, or seeing a lot of a particular cancer on one side of the family, see if you qualify for genetic testing. Some insurance do cover genetic testing if you meet certain criteria. If insurance doesn't cover it, you could pay for that out of pocket to see if you have any of those mutations that could increase the risk. And that's important information to know, because there are different screenings that might need to be done in an individual that has, for example, the BRCA. We've got to be careful about mammograms. People might be considering prophylactic mastectomies, also increases risk of pancreatic cancer and ovarian cancer. So they'll need some more screening. So genetic testing can help someone understand a little bit more about their individual risk, based on what we know now of the genes that we do know about now. There's definitely more down the pipeline. But then screening. That's also something that somehow has become controversial, screening. But recently, guidelines are going to be changed about changing screening for mammograms to begin at 40. Many organizations were already recommending 40, but the U.S. Preventative Task Force was still around 45. So reducing screening or increasing screening for breast cancer. And actually we're thinking about having adjustments for women who are Black, because they have a higher risk of breast cancer.
Were some groups kind of pushing for, and maybe it was just the natural crowd, but you're going to know more, for either decreasing the mammogram or even like increasing it to 50 or something? Did that get like written into policies in some insurances, do you know of? Or
people pushing that we don't do mammograms?
Right. Well, there was some of that, but then I think there was also just we don't need them so early either, to reduce the exposure risk.
Yes. And so, but that's where the new guidelines actually came out and said doing earlier screening would be better, because we are seeing, this is one of the cancers where we are seeing an increase, is breast cancer. And we're seeing an increase in Black women. They're actually thinking of like maybe those that aren't as high risk, like Hispanic women actually have a lower risk of breast cancer. They might not need to screen that early. But someone who has identified the BRCA mutation, they're going to need screening even earlier than that. So actually the latest guidelines from U.S. Preventative Task Force was to move it to earlier screening. That has happened as well with colonoscopies, have moved that to have earlier screening. I feel like maybe in our lifetime, we're going to see that pushed even earlier, because we're seeing this increase in the young adult population, because even 45 might be a little too late for that. Cervical cancer screening, those guidelines have been out for a while. Women get that every 3 years, the pap smear, pretty easy. Also for those that have a history of smoking, there is some recommendations for annual low-dose CT scan to catch lung cancer early too. And why this is so important is like, yes, there could be some risks. Like for example, with mammograms, the risk of, is there a false positive? Because women have lots of bumps and lumps in the breast, and having to do biopsies and risk factors of that. So it's something someone should definitely discuss with their provider. But we know that the earlier you identify this, the better the survival outcomes are going to be. The less treatments they're going to need. And we know that many of these treatments carry long-term side effects too. So we've got to look at that long game.
Yeah, that's so helpful. I mean, I think oftentimes in the science, it has become so advanced and there's so many new treatments and all of this stuff. But then what we actually implement and practice always comes down to some really basic strategies. I mean, fruits and veggies, nothing new there. And then make sure you see the doctor and keep your regular screening appointments, right? Are some of the best steps that you can do. What do you know? And I saw a little bit on social media, so gosh, only knows what's true is not. But what do you know about some of these new blood tests coming out potentially for screening? Is that looking promising, or what's your current knowledge of that?
Yeah, that is something not standard of care yet, but there's some circulating, what they call circulating tumor DNA, so very small fragments that could be associated with certain cancers, to screen for those. And if you see an increase in that, then do the screening that's necessary. There's a lot of that work in kind of surveillance after cancer, looking for these really small molecules, which I think is going to be really important for overall better outcomes. But that is not, conventional standard of care yet, but there are some of these tests available based on some of the limited information we know about certain cancer types. It's not going to be able to detect all potential cancers and identify these markers. There's just some. But there's a lot of research, and I think that is very exciting, that if there could be something like part of your annual, right? Just like you have your annual lab work for your lipids, could there be an annual blood draw where you could look for these biomarkers? Definitely an active area of research, and I think will be really transformative in cancer.
Yeah, you made me think of it just because of ovarian cancer and just difficult to kind of screen. And so, I was thinking about, well, what, you mentioned that the current screening policy is earlier. So I was just sort of curious about that and whether or not the blood work has been more of that approach for screening yet, but I guess not the blood test yet.
Yeah, not yet. There are some tumors, call them tumor markers, but even people who have that cancer may not have that tumor marker, and we can't even use that as a tumor marker to monitor how they're responding to treatment. So it all depends on the individual's cancer and what mutations it has.
Interesting. I do want to ask about a couple specific diet trends that I get asked about often from kind of the prevention point of view, and you haven't really mentioned them. They weren't part of the AICR's recommendation for their 10 preventative things. So let's get your understanding. The first one is fasting, with the idea of, helping the body get into these phases of autophagy and whether or not that will prevent cancer. What is your take on that research?
So there has been some interesting, preclinical work looking at animal models. We have not seen anything come out of human trials. Yes, there's this potential mechanism if you look at that in a petri dish or in an animal, but do we see that it actually increases autophagy and lifespan and cancer risk in individuals? We don't know. And we don't have that data, and that would take a very long randomized controlled trial to do. And then we see some of the stuff that was done in animal models of fasting. There tends to be weight loss, and if studies don't control for weight loss, that is a big covariate there, because weight loss itself can reduce the risk of cancer if there is overweight or obese individual. So as far as what we've seen in cancer risk, we just don't have the human data. There's mechanisms that, yes, it's helping potentially with the body identifying or cleaning up the bad cell or not good cell, but all it takes is one to bypass that mechanism and you have cancer.
Yeah, so for people that are already normal, healthy weight and active, that this idea of adding a fasting protocol on top of that would confer additional cancer prevention. We really can't say that.
Yeah, I confidently say that it would. And I think it's still really important too, because these fasting protocols, it matters. Well, what are you doing in that window when you are eating?
Right. Thank you.
You see plenty of people losing weight on this fasting protocol and they just ended up in a calorie deficit. But if you haven't increased your fruit and vegetable intake, you're still eating a lot of red and processed meat, and you're having beer or a glass of wine, there's still an increased risk from those dietary factors as well. reduce that risk just because you ate that in an 8-hour window.
Yeah. Yeah. Okay. Good. Glad I'm saying it correctly. The next one, I see a good number of questions asking about more low protein diets. I think it's out of a fear of that protein can increase IGF-1, but this idea that low protein is more associated with longevity. And of course, this is of a concern in my community where they typically are higher. I'm not at the high end of protein recommendations, but they're certainly higher than the RDA. So what's your take on kind of low or high protein diets and cancer risk or prevention?
Yes, so there is that association of low protein intakes with lower levels of IGF-1. And then IGF-1 has been associated with some cancer types. I think is a really important point there. So there are some cancer types that have been associated with higher IGF-1. Some of them have had no association with IGF-1. Right? And another factor we know that increases IGF-1 is poor metabolic health, again, overweight and obesity as well. So another example is, well, dairy is a little controversial, but dairy intake has been associated with higher IGF-1 levels. But dairy intake has not been associated with breast cancer risk, for example. And breast cancer is one of those that has been associated with IGF-1 levels. So there's still not this clear, this increases this biomarker, and then that increases your risk of cancer. We just don't see that nice linear correlation yet.
Yeah. And yet we do see that increased risk with the unhealthy weight consistently.
Yes, and if higher protein intakes are supporting someone's weightlifting, physical activity, and then also too, to be really important that it's grouped as protein, but when you look at the literature a little bit more, got to really tease out the type of protein. That when there have been some studies that have teased out type of protein, it seems that more animal proteins tend to be associated with an increased risk of cancer, not necessarily the plant protein. And so kind of back to those ARCR guidelines, they don't say no animal products. And even with the red meat, they say keep it to 12 to 18 ounces per week. So even with all that body of literature, there isn't this evidence to say you shouldn't be eating protein or including animal protein in your diet.
Yeah. Yeah. Well, you can't bring nuance to social media. So
no. Exactly. And people are like, okay, well, fasting helps you in your metabolic health. And that's really the key there is that metabolic health component. But we still have to factor in what are you eating? If you're not eating protein, back to that protein, what are you filling your plate with then? Is it more just starchy carbs, processed foods?
Yeah. Awesome. Well, thank you for sharing all of this information with us. I would love if our listeners could get some insight of where to find some more information. Now, we are going to talk about, you have an Instagram handle, Cancer Nutrition HQ, which is phenomenal. But I do think some of these websites that are put out by government or government-like organizations are quite underutilized by people. So do you have any references to send people to for maybe some statistics or just basic information?
Yeah, my favorite consumer-friendly, public-friendly resource is the American Institute for Cancer Research. I've given them a few shout-outs today. They've got great recipes, blogs, all their reports are free to access, lots of great infographics. They even have some free online programs about incorporating these cancer prevention recommendations, so really highly recommend that resource. And they're a nonprofit organization, not a government organization, but the National Cancer Institute is another resource. It's a little clunkier to go through and find the more public-facing information. The Leukemia and Lymphoma Society is actually one that I recommend for those going through cancer treatment. Even if you don't have a blood cancer, they have really great organized information about diet during and after cancer videos. They even have some free consultation with a nutritionist during cancer treatment too. So they've got some great free resources.
Yeah. I was looking at the AICR's website before our recording here and really liked it. And I would just like to remind people that Krystle mentioned all of these basics that we need to do. And that when you go to this website and you think that it's not being specific enough on, some really unique new diet trend, that it's probably because it's the basics where we have a lot of evidence. And so to run with kind of what they have there and their recipes, like you mentioned. So thank you for those resources. Awesome. So yeah, Instagram, follow Krystle, Cancer Nutrition HQ, correct?
Yeah.
And also you do take one-on-one clients for people that are going through cancer or post-cancer?
Absolutely, I do. Yes.
Okay, awesome. Well, we will put the links in the show notes, and I really appreciate you taking the time to be here today.
Awesome. Thank you for having me. Great questions.
Thank you so much for listening to this week's episode. Thank you to Krystle for her time. Again, if you want to find her on Instagram, it's Cancer Nutrition HQ. Her website is also cancernutritionhq.com. One more reminder, if you're not yet subscribed or following the show, wherever you are watching or listening to this, please do. That will ensure you do not miss another episode, and it will help EC and I sleep a little better at night. So thank you in advance. EC and I will see you next week for another episode of The Consistency Project.